Hello, I'm Dr. James Bogash, Master of Health and Longevity and creator of Modern Health Myths. And today we're going to talk about something that I've brought up a million times before, and that is how much did our response to COVID create a worse outcome with COVID? We certainly, if people just put on blinders and look at the deaths that we had associated with COVID and did not understand the loss of everything else based on our response to COVID, then they are not looking at the whole picture and they do not understand at all the gravity of what we did on society. It's great when you live in your perfect little bubble and you've got internet and your kid has access to healthcare and food and internet and their iPad to do. But what about the other billions of kids across the globe that didn't have that? So you need to stop thinking in terms of the deaths associated just with COVID and need to understand that there are far more likely a much greater increase in death and disease as a result of our response. Which takes us to this particular article. And let me start by saying that it is now well-founded that substance use has gone up as a result of the lockdown. That's alcohol, that is opioids, that is, we've seen heroin use going up as a result of this, marijuana use. Everything we don't want to happen is how a lot of people are dealing with the pandemic and the stress and the lockdown and the loss of the devastation of the economy. So this particular study, they looked at the medical records of 73 million patient visits. So we're talking about a lot of data here. And they found that substance use disorder, picture substance abuse, I'll cover those in a second, had an people with substance use disorder had an 870% higher risk of COVID hospitalizations and deaths. Let me say that again. 870% higher risks of COVID hospitalizations and deaths. That circles back to that population with substance use disorder has gone up because of our response to COVID and the lockdown, not from the virus itself, but from our response to the virus. To get specific, the numbers get a little bit scary. Opioid use disorder, which is obviously as a chiropractor, it's something that we try hard, and the data is very solid about us helping with avoiding opioid use disorder. But 10.2, so over 1,000% higher risk of COVID hospitalization and death. With alcohol, it is 7.8, so 780% increased risk. Tobacco increased 820% risk, COVID hospitalizations and deaths. Cocaine, 6.5, and low end of the list is cannabis use, but still a 530% increased risk. So the reason that these substance use disorders have gone up is because of our response. Now the situation that we have with increased people with increased use of substances to manage the situation that they're in, they are now at increased risk of COVID hospitalization and deaths. You cannot look at the number of deaths and not look at the devastation elsewhere. If you do, then I don't know what to tell you. You've got blinders on and you don't understand the full ramification of everything that happened from the decisions that we made. As always, I will post a link to this particular study in the comment section. Make sure you like this video, share it with somebody who's only looking at COVID deaths and not the ramifications, and subscribe to the channel.